We are working with Dr. Brown and appreciate his support on looking at how we can better serve underserved communities within South Carolina, a very important topic for me as well, and something that I've been focused on since I've been here, and we appreciate your leadership on that, sir. We'll be releasing a statement on that soon. Dr. Traxler and her public health team are working on that. So that will be coming soon, but then obviously follow the statement's fine, but then we have to have action. And so we have a number of things in the pipeline that we are working on to increase our support of underserved communities. Our mobile units will actually be one example of that. Many of those will be going into underserved communities for folks who can't get to the vaccine. We're going to bring it to them. But we're also working on a number of environmental justice issues. For example, Myra's team is working with a number of communities, this was just in the newspaper, on hurricane preparedness in areas that did not get that sort of attention in the past, but certainly need it and are certainly at risk. So you'll see a number of things coming up from us over the next several months, and I'll keep you updated on that for the board. But I think that's going to be a very important effort for us. We're also, as you know, we recently got our budget approved at the state level. The legislature was very generous with DHEC. We very much appreciate their support. We got several $1 million to help with salary equity. Some of our most critical positions right now, our salary levels are below the state average. Not just the commercial average, which, obviously governmental positions usually do not pay as well as commercial positions, unfortunately, but we were even under the state average. So they gave us quite a bit of money to help. It doesn't cover all of that, but it will help improve the competitiveness as we go out into the market and try to recruit people. As I go around and meet the staff, we have many people here who've been here 20, 30, 40, even 50 years. We have incredibly dedicated staff who have been here for a long time and do an incredible amount of work. We should pay them fairly, and we are working on doing that. So we very much appreciate the legislature's support on that. The legislature also gave us all of our funding that we did last year, which is good. They also gave us a number of earmarks. You've probably seen a lot of coverage in the media about that lately, so I will tell you how our agency is planning to address that, certainly subject to your guidance, is that we will be requiring all of the organizations and municipalities who've got an earmark that will be flowing through DHEC to give us a spending plan consistent with the governor's guidance, to show us how they're going to spend the money. We're going to review that and make sure it's being used responsibly in a way that will benefit the people of South Carolina. And we're going to require them to report outcomes that actually are meaningful to the people. It's great to know how many folks got a test, if that's what they're doing or what they built. But my question is, what impact did that have for the people of South Carolina? So did you prevent disease? Did you improve flooding situations? Did you get clean water to more people? So those are the kinds of things we'll be looking for as we set these outcomes measures. And we will be transparent with those and let you know how they're doing and how that money is being spent. So with that, the last thing
Will we get copies of that?
Yes, sir, we will. Yes. As we work forward, they're preparing we are going to be going out to these organizations, working with them, and we will make sure you get a copy of all the final agreements we have. And then obviously the outcomes as they come in. Yes, sir. And then finally, on the environmental side of the agency, doing a lot of work right now with hurricane preparedness, as I said, working with a number of communities on outfall channels and improving flooding situations. We just had not too long ago, a ribbon cutting in Beaufort, area I know well, of course, on a project called Mossy Oaks, which was permitted through our agency. And during the recent tropical storm Elsa, when they got almost 8 inches of rain, that area would have been underwater before. Because of that project, the water drained off and they had no damage, which I think was very impressive. And so we're working now on a number of other communities on similar projects to help make sure they're prepared as tropical storms and hurricanes come. And that, sir, is my report.
All right. Any questions?
I have a quick question on the park where you're going, working with the parks and stuff, and also the mobile units. Is that the Janssen, the one and done? Is that what we're using?
Mr. Kenny, actually, in many cases, we're offering folks a choice. And we have some people who really prefer this 2-dose shot, and we want to give them what they're willing to take and what they feel most comfortable with. So we're certainly offering people the Janssen vaccine whenever we can, especially in those situations where it's going to be hard to see them again. But if they prefer the 2-dose vaccine and we have it, we will certainly offer that to them. So we try to give people a choice.
What kind of response are you getting from different age groups?
It hasn't changed very much. The older folks are very interested. Folks like me, right, are very interested in getting the vaccine. And in fact, if you look at our over 65 numbers, they're outstanding. We're doing very, very well with folks over age 65 in terms of getting vaccinated. Middle-aged folks, I think we're doing pretty well too, if you look at the numbers. Really, our biggest deficit is age 20 to 26, 26 to 35, that range. And you know, it's not so much that they're opposed to the vaccine. I mean, there are folks out there who are very opposed to the vaccine and are anti-vaccine. Really, mostly, I think what we're seeing is they just don't think they need it. A lack of urgency. It's not important. It's not going to happen to me. If I do get it, I'll just be like a cold for a couple days and I'll be fine. We hear a lot of that, especially in the younger population. You know, they may not know someone who's had a serious case of COVID, or if they do, it was someone who was much older than them. So that's what we're hearing. I think what's somewhat encouraging is we are seeing a fair number of parents bring children in, 12 to 17, school-age children. We're getting a better response there actually than in some of the little bit older groups. So I'm encouraged by that, and we certainly encourage parents to go ahead and bring children in. We're working with school districts to have clinics in schools. You know, they have to get consent from their parents, of course, if they're under 16. But we're trying to make it available through schools, again, make it easy to get. But really what we're hearing a lot of is simply, I don't think it applies to me. I don't want to take time off from work to go get the vaccine. I don't have the ability, you know, if I get sick from the vaccine and need a day off, I don't have a sick day. So I really think that's what we're seeing right now is more practical barriers to getting the vaccine and just a belief that it's not that important to me, as opposed to, I really think this is a bad thing. So that's what we're hearing from folks mostly.
I'm hearing from at home too.
Yes, sir.
All righty. Anything else?
No, pending any questions?
Any other questions?
I've got observation.
Yes, sir.
I've been in a position here for about 30 years now, and I've been on the other side of the fence, quote unquote, and I always dealt with the agency. And I always knew you guys had the best and brightest. But now that I'm on this side of the fence and knowing some of the staff and the members, team staff and professionals from top to bottom, they're second to none. I mean, the dedication they have, the commitment, it's impressive. And I think the citizenship of South Carolina should realize that too. Somehow get the word out. But you guys have got a great team, great team. I'm glad to be here. It's very impressive.
Thank you, sir. And I couldn't agree more. Thank you.
Is that a mission for you?
What's that, sir?
Is that a mission for you?
Yes, sir.
They're doing it.
Good. Thank you. Appreciate that. All right. What's next? Bentley. Good morning.
Good morning, Mr. Chairman,
Good to see you.
members of the board, Dr. Summer, and council. My name is Bentley White, and I'm the director of the Office for Policy and Communications for Healthcare Quality. I'm here today to report the healthcare quality administrative and consent orders